Hi, my name is Karan Varshney, and I'm presenting this work on behalf of my team. The title of our work, which is a systematic review, is Risks and Consequences of Nyaope or Whoonga Usage. None of the authors have any conflicts of interest to disclose. So starting off is, what is Nyaope? Nyaope is the name of a street drug, a new street drug that has risen specifically in the South African context around the early 2010s. Nyaope, which has also been referred to as Whoonga, Thai, Plazana, Kwape, Unga, and Bomkan, is a new drug cocktail that has been shown to have a number of different substances, ranging from heroin to detergent to rat poison to perhaps of the most pertinence, and which is going to be really a reason why it's one reason why it's becoming such a big issue is also HIV antiretroviral drugs. To really understand why this drug cocktail, this street drug, has emerged specifically in South Africa requires an understanding of the HIV epidemic in this country. South Africa currently has the highest number of cases of HIV in the world, more than the next 4 countries combined. And to get an idea of the scale of this issue, it is worthwhile to compare total populations. For the same number of HIV cases, South Africa has a population of about 59 million, whereas the next 4 countries combined have a population of almost 1.7 billion, billion with a B. This is about 28 times higher, and this really just gives an idea of the scale of the epidemic in South Africa. And so with this in mind, the government has taken major actions, to try to address the HIV epidemic in this country. One such action has revolved around ensuring readily free access to HIV antiretrovirals for many in the country. However, a consequence of this has been the diversion of such drugs for recreational purposes. And to understand why this is so, one needs to focus on the antiretroviral, the ARV, efavirenz. This drug, an important part of the HIV treatment regimen and in Nyaope, has been shown in a number of studies to have psychoactive hallucinatory effects, comparable to LSD. And so this effect has been shown to be amplified when combined with certain substances. Therefore, more and more, this drug is being used as a substance to gain a kind of euphoric effect amongst users. And in order to try to address the emergence of Nyaope usage in South Africa, the government has made efforts to try to curb its rise. And the government has attempted to impart a clear message that Nyaope usage will not be tolerated and that the legal ramifications of usage or even carrying Nyaope will be severe. Big fines and long prison sentences have been made to serve as punishments as deterrent measures. However, despite these efforts by the government, Nyaope has been shown to continuously be a problem in South Africa, and it seems to be getting worse. Here's an example of an article describing some of the actions of the Nyaope user in the media. In this case, a man set his home ablaze. In another circumstance, a number of Nyaope users had gang raped a woman. As well, Nyaope has been affecting youth, and it is increasingly becoming aware that this may be a much bigger issue that is anticipated. Just to let you know, all of these articles are from 2021. And so with this in mind, there is a clear imperative to better understand the impacts of and risks of Nyaope usage by studying it. Hence, the goals of our work were to conduct a systematic review in order to try to better understand both the risks and consequences of Nyaope usage. We conducted searches in 8 different databases to try to get as many articles as possible for our review. And of those, ultimately 21 were eligible for inclusion. All studies were conducted in South Africa. As shown in this visual depiction here of the study quality assessments, with the number of yes responses indicating a higher quality overall. The studies were moderate to good quality overall, with some exceptions, some being quite low, one or two being quite high, actually. And the study methodologies themselves ranged, with the inclusion of mostly qualitative studies, but also some cross-sectional studies, case reports, cohort studies, and a single case control study. Across the included studies, if we move on to risk factors, one of the most frequent risk factors for Nyaope usage cited was unemployment. These are a few quotes at the bottom encapsulating the realities for jobless Nyaope users. Numerous studies have shown very high unemployment rates amongst Nyaope users, with one being as high as 74%, another at 86%, 96% of Nyaope users being unemployed in another study, and one was 100%. All Nyaope users were unemployed, indicating just how important of a kind of risk factor this is. Prior substance use and co-substance use were also frequently noted as risk factors for Nyaope usage. The most commonly used substance associated with Nyaope use was cannabis, with the quote at the bottom there. But other commonly used substances, though not as common as cannabis, were tobacco and alcohol. And one study found that 52% of Nyaope users previously used cannabis, 13% used cigarettes, and 14% used other drugs, including substances such as alcohol. If we branch out and focus on a number of the many different risk factors found, after we consider the most significant factors which are already mentioned, unemployment and prior co-substance use, there are others that are such as limited familial support, pressure from peer groups, being HIV positive, being an adolescent or a young adult, particularly if you're Black, and being male. So with all this in mind, we could expect that the typical Nyaope user is going to be a young, unemployed Black South African male who has a limited support system and a peer group that encourages Nyaope use. However, we should also be cautious in overly narrowing our scope to this demographic. This is as one study focused specifically on young female adolescents and found that Nyaope usage was also an emerging issue in this demographic. So we want to be careful. In terms of consequences, the most commonly noted repercussion of Nyaope usage across studies was the intense addiction that this drug causes. The addiction was shown to be stronger than those for several other commonly used illicit substances, and many remained addicted despite being on treatment for substance use. Additionally, the seriousness of withdrawal after one ceases to use these drug mixtures provides further insight into the dangerous nature of the drug's addictiveness. The withdrawal effects of Nyaope, which can occur for as long as about a week, include the appearance of flu-like symptoms, nausea, severe cramps, cold chills, frequent sweating, and constant diarrhea, as well as an inability to sleep and intense pain. Due to the addictive nature of Nyaope, it has also been shown that this has been linked, due to the addictive nature of Nyaope, there's also been a link with criminality. Study participants frequently partook in some kind of criminal behavior, frequently using all of their income to obtain more for the substance. It was, in particular, there were cases of people stealing drugs and mugging and ambushing HIV positive individuals. Social rejection emerged because what was happening in a lot of circumstances, people were stealing, but they were also stealing particularly from their parents. These quotes at the bottom are quite telling, particularly at the bottom, where one of the users describes the potential to kill a family member to support their addiction. Dropping out of school was also frequently a repercussion for many Nyaope users due to their addiction, many of whom were desperate to get more of the drug. And when we combine all these factors, stigmatization at a societal level and an individual level are also a very real phenomenon. Additional consequences in terms of psychological symptoms. Nyaope users, tend to show high rates of each of these psychological symptoms: depression, negative self-perceptions, loss of motivation, mood swings, and in even some cases, some individuals showed hallucinations. An array of physical health issues were also described amongst Nyaope users. Infection rates were particularly high amongst this group, with the pathogens of tuberculosis, hepatitis B and C, and Staphylococcus aureus in the context of infective endocarditis being issues. Erectile dysfunction was also prominently noted and emphasized in one particular study. As well, cortical atrophy, which is essentially withering of the nervous tissue in the brain, was also shown to be a major problem amongst some users. From one of these papers is a figure that's shown here, and the red kind of depicts areas of high atrophy. Also, notably, usage of Nyaope amongst pregnant mothers is particularly dangerous for the infants. In one case, an infant cause of death was attributed to Nyaope use, and in others, infants face severe issues after Nyaope uses of their mother that may be permanent, of course, while the mother is pregnant. With moving on, in terms of all the findings now, we can try to think of what implications, what policies can be recommended and emerge from this with our findings. And the first relate to rehabilitation programs. Creating and strengthening rehabilitation programs to support Nyaope users will be vital. Such programs can help these addicted individuals to deal with their drug issues by dealing with the withdrawal symptoms themselves and creating more detoxification services that are unique to these particular substances. Offering support through counseling and group therapy services may also offer utility. As well, to ensure that Nyaope users do not eventually relapse, rehabilitation services should make efforts to ensure that former users are able to reintegrate into society. helping individuals find employment in particular can be a valuable means of ensuring complete rehabilitation and ensuring that they're able to have some kind of role in society, even if the employment is temporary. It can provide them a trajectory, a better trajectory of returning back. In terms of Nyaope prevention efforts will be integral and can happen in a number of ways. One way in which this can happen is by having educators share media reports that provide truthful information about the most devastating effects of mixtures with ARVs to deter more youth in the future. A lack of public knowledge about the dangers of Nyaope demonstrates that resources should also be invested in informing adolescents, young adults, and wider communities as a whole about the risks of consuming this drug mixture. As well, messaging to the public by creating publicly funded public broadcasts and education campaigns warning of the dangers of Nyaope can make a difference. Furthermore, specifically having a focus on high-risk communities and high-risk groups can result in lasting changes that deter individuals from using Nyaope. Younger individuals with a high level of substance use of other substances such as cannabis, tobacco, and alcohol tend to deal with neglect also and come from challenging home environments. Reaching out to these high-risk individuals, who tend to be, again, Black young males, to lower their levels of substance use can potentially lead to lower Nyaope usage over time. And with that, I'd like to close and just once again say that Nyaope addiction is increasingly becoming a larger and larger issue in South Africa. The dangers of addiction indicate a need to enact policy to support users and to lower rates of usage. Further research is needed to further evaluate the realities of Nyaope use, and more research is also needed to determine what the most effective solutions can be. And here are my references. And here is my contact information as well, my email address. Feel free to contact with any questions, any requests for references, or anything whatsoever. Thank you so much for listening.